Thanks very much, Rick. This is my second Beacon Rare showcase, and it's just as good as the first one I attended. Really pleased to have the opportunity to speak to you all. I'm absolutely delighted to be able to do this presentation directly after Minister Dalton's announcement there, which is tremendously good news for us. It gives us space to have a conversation. So I'm going to hopefully make the case for that conversation and introduce some of the themes that we'll need to bring together to make the case that Minister Dalton's asking us to make. Right, first of all, I'd like to thank people living with rare conditions, all of our members who provide us with all of the stories, all of the arguments, all of the evidence that Genetic Alliance UK uses to bring to conversations around the rare genetic and undiagnosed space. We can't do this without our members and the people that they represent. So thank you. A little bit about who we are. I think our logo alignment is non-ideal there, but we run Rare Disease UK, which is the campaign to keep this framework running. We host Rare Disease Day with all of you, which is happening at the end of February. Hopefully you're all aware of that. We also host Swan UK, which is the support network for people living with undiagnosed genetic conditions. And we host the parliamentary groups that look at genetic rare and undiagnosed. I also want to acknowledge that we prefer talking about people with rare conditions, but often our policy ends up talking about patients with rare diseases. So you'll see me slip to the wrong side occasionally. That's usually because of the title of a piece of policy or a role or something similar. So today, wrong way, I'm going to talk about some focus policy and then overarching policy leading up to the big overarching policy that we believe is crucial to maintain the progress that we've seen over the past 5 years and also we'll be hearing about for the rest of today. So I think it's really interesting to have this conversation in the context of hearing about so much progress. And then I'm gonna, because I've got the opportunity, Rick, I'm gonna talk about Rare Disease Day as well. So focus progress. How many people spotted an announcement from the Medicines Healthcare Products Regulatory Agency about 2 weeks ago? A big announcement. I'd say that's a good, but for this audience, maybe that's not the best response rate, I think, to that question. So the MHRA announced work that it's been doing as part of its rare consortium. And I don't know how many people have spent much time with regulators. They're lovely people. But wild isn't a word that you'd usually use to describe them. But what actually this group is proposing is wild in the area of regulation. For all the time that we've had the kind of systems that we have now, we have two licenses. We have one to do a clinical trial and one to input the results of that into regulation, the market authorization. So two licenses. What they're doing, the wild move, is to propose the opportunity to potentially have a third license that sits somewhere in between. And that is really ambitious, and it really does open up a lot of potential to bring more treatments to people living with rare conditions, and does actually put some conditions that might not have expected to have treatments regulated in this way into the arena. So that's the level of ambition we need for the next 5 years. We do have some other ambitious things happening. So we're reviewing the genomics medicine specification in England at the moment. And some of the themes in that are really strong. Some of the opportunities there to both keep kind of rare care central to the delivery of genomics while we mainstream genomics is looking amazing. We have a digital rare care centre in Wales, which is bringing forward care coordination techniques that are quite innovative. We've had all the progress with the launch of two parallel research programs, the Life Arc Translational Research Centres for Rare Conditions and also Rare Disease Research UK. All very ambitious. We also have bits of specific policy that we need the same areas of specific policy where we need the same level of ambition and we don't have it yet. So newborn screening is an issue where the UK is a long way behind most other similar countries. We're only screening for 10 conditions where most European countries are way past 20. We do have the generation study, which is very ambitious, but the pathway to deliver that is hazy at best at the moment. And the same for medicine funding. Um, Almost any topic that we bring up with our members leads to the question, but how will we pay for it in the NHS? And that's the right question to be asking. So how do we have that complete view of the whole pathway? We need these focus bits of progress to make really detailed changes that are absolutely perfect, or the best case for the target that they're aiming at. But we also need that overarching view, and that's why overarching policy is also helpful. Um, so strategic oversight is useful, and I'm going to start by talking about the 10-year plan, because my role here was to introduce the policy landscape, and this is the health policy landscape in England at the moment. Um, this was launched in the summer and sets out the government's intentions around the NHS over the next 10 years. And it's given all of us working in the health policy space the challenge of translating everything that we think and everything that we need into one of three shifts, which is quite a useful discipline, actually. It's interesting, and sometimes we need to sometimes things don't fit, let's be honest. So the three shifts are analog to digital. I've heard some people argue that this one is so fundamental that potentially it should be sitting above the others as the thing we need to do first and the thing we need to get right before any other positive change can really have impact. The second is hospital to community, and the third is treatment to prevention. And that's a difficult topic for us to translate into our world because preventing rare conditions isn't possible for many of them. But we can translate that into early identification and prevention of impact of rare conditions, or prevention of comorbidity or progression of rare conditions. I put this "we shall go to the moon" point here. JFK said we're going to go to the moon. He didn't know how. And it took almost 10 years for that to happen. And some of the announcements in the 10-year plan are similar in the scale of ambition, but also the lack of clear pathway to deliver them. And some of the ways that genomic medicine is being presented in the 10-year plan does feel a bit like that announcement. So I think it's also worth thinking about whether we need to kind of fund NASA a bit more, or build up some of that work. It's worth thinking about how long we actually have. At the moment, it might not be the case that we have the current government for 10 years to implement this plan. So what can we get out of the current situation? Worth noting that Nixon was actually in power when man landed on the moon. So that doesn't mean that you shouldn't look to the future in the case of a turbulent political landscape. I'll stop talking about the moon. I think, why do we need to do this? I mean, we need to be looking at what's necessary to make sure that the level of ambition organizations like the MHRA are putting out there is going to land at the end of the pathway. So will it actually make a difference to people living with rare conditions in the UK? So these kind of strategic oversight policies give us that overview. And there are a few ways that we need to look. Gaps in the R&D pathway. Do we have all of the steps to go from basic research, translational, clinical trial, and then implement those findings adequately and effectively and ambitiously in the UK? We've spent a lot of time over the past 5 years investing in diagnosis, and I think we've made an awful lot of progress. But are there care pathways for all of those? We have a list of all the genetic conditions we're going to be diagnosing in the test directory. Could we use that as an audit tool for the NHS? And I've spoken a lot about England, but there's a lot of other activity happening in the devolved nations, and we should expect changes coming in from the elections there. But this is just the NHS, actually, and that's why we need the UK Rare Diseases Framework, because rare conditions we can't solve all of the unmet health need that's facing our community with just the NHS, just the NHS. We've had long-term policy for rare conditions for a long time. We had our first strategy in 2013. That was replaced by the framework, and we heard from the minister on how much has been achieved in the delivery of the framework. And I think there's a lot that's been achieved, but the scale of unmet health need that our community is facing is enormous. And a lot of what's happened in the first 5 years has building a platform for what we can do in the next 5 years. I think we can scale up our ambition. I want to make sure we've got time for questions. So, and hopefully we've made the case, and you'll hear the case today, that there's an awful lot to rare disease and a lot that needs to be done to coordinate all of those activities. I think the minister's asking us at the moment to make the case again for a UK rare diseases framework. That we need that overarching policy to make sure everything fits together, and it needs to be UK-wide, not siloed within the 4 nations of the UK. So let's make that case again together. We've started the conversation. We made the case with the manifesto. A theme for what we're trying to do is to collaborate as much as possible in this argument, in this conversation. So we've been doing joint working, the Specialised Healthcare Alliance and Genetic Alliance UK worked together on a manifesto. We worked with LifeArc on a report on accelerating R&D, and a lot of our members and stakeholders in our space came together for Rare Disease Day to make that case again. And the conversation's been happening in lots of the delivery groups around the Rare Diseases Framework as well. And Minister Dalton wrote to the 4 nations. We then supported that argument, and we have arrived now at the point where the ministers announced this. And we've been thinking about this. How can we have the best conversation? How can we make sure that the case is as comprehensive as possible? So we have a plan. This is a proposal that we want to work together with everyone in the rare community on. The first step is to bring all that can contribute to this into an oversight group so that this plan is improved. This is our proposal, but we want others to feed into that. And we're concentrating at the very beginning by bringing all of the different rare communities together, the multi-condition communities. So we have RareDAR, which is a community for non-genetic rare conditions. We have Living Well, the campaign for Metabolic Support UK, Gene People. I've got a date in your diary, Rick. And this is a multi-stakeholder conversation. So the Bioindustry Association are also involved. And we'd be looking at many more to be joining that steering group. And the plan is that we'd have a 4-phase process where we collect all of the views of what people have been saying over the conversation over the past year or so. We engage the community in getting as many ideas as possible, as many needs as possible together, and then validate that with a survey. We can empower everyone to have their own consultation with a workshop in a box, and then move into a working group phase where we would have different stakeholders lead detailed working groups that would be able to put together that argument that the minister's asking for. And then I've put October here, but I think we need to shorten that timescale given the request from the minister today. So then a summit meeting where all of those working groups would report to the whole rare community on what we need. And that would be the set of evidence that we give to government. I don't think it's I don't think that there's any question that we can make this argument. We just need to actually absolutely nail this opportunity to make it as coherent a vision as possible for the future. I wonder if we should have questions now. Or shall I quickly whip through Rare Disease Day?
Yeah.
Yeah. So the theme this year, which is really important both for the conversation that we're intending to have over the first half of next year, but also for key overarching policies like um, the 10-year plan for health in England and the elections coming and so on, is equity, and therefore inequity as much as equity. Um, this is the international theme for Rare Disease Day across the world, led by Eurodis. Um, and there's a tremendous amount of work that's already happening, both within the Alliance of Support Organizations for Rare Conditions and more broadly. This is a theme for many of the professional organizations this year. And importantly, is rising up the agenda all the time. It's an underpinning theme for the England implementation of the UK Rare Diseases Framework. And there's a tremendously valuable annex for those of us that get to annexes in policy documents. Annex E of the UK Rare Diseases Framework implementation plan for 2025 completely sets out the landscape for equity conversations in rare, which is really, really valuable. We will be putting together these tools. So we want to empower our community to have a conversation to talk about equity from your perspective and in equity, what dimensions of equity are most challenging to your particular rare condition. And we will be, of course, doing a Rare Disease Day report that will set out this landscape. And I think it's in a fair way that doesn't try to pit us against other communities. I do think we do have to shine a light on some of the challenges that our community face in comparison to other areas of health that might be better supported. And one of the positive lenses we can take is that rare disease has challenges. So diagnosis, difficult for rare conditions. Care coordination is difficult for rare conditions. Getting that R&D pathway running is more challenging in rare than it is in common complex conditions. So if we build a system that works for us, then ideally you've built a system that works for everyone. So can we make that paradigm message land? And I think I will just finish by sharing our Rare Disease Day email address. We've had a get together with our membership already on this. We will have more of those, but please do email us and get in touch about how you want to participate in Rare Disease Day. I'm not just talking to support organizations, I'm definitely talking to people living with rare conditions, but also wider stakeholders as well. Thanks for the opportunity to plug Rare Disease Day, Rick. Shall we talk a bit more about the announcement the minister made and the conversation that we want to have, or any other questions about overarching or specific bits of rare policy?